All right, this month, doctors across the nation are really taking their practice to heart, literally.
February is American Heart Month, and today we're taking a look at what you need to know to stay healthy. Dr. Warren Levy is the Chief Medical Officer of the Cardiovascular Group, and he has some things that you really need to pay attention to.
But
Doctor,
you know what he said first?
What's that?
Before we went on the air, he said, alcohol is good daily.
Oh.
A doctor said this? You knew I was going to get you on this one, didn't
I
you?
was hoping you wouldn't. Actually, the reality is the data does support that. The problem is we can't recommend that population-wide because you just don't know who's going to abuse alcohol.
Well,
but there is a lot of data that says 1 to 2 alcoholic beverages a day are very beneficial in terms of reducing heart disease and diabetes.
You, of course, were kidding. I hate to put you on the spot. We are kidding about this.
Well, it's actually the truth. I wasn't kidding. And
well, I mean, kidding because we had the beer earlier and saying, you know, let's start with beer, but that is some data. But we're here because it's Heart Month, essentially.
It is. This is an act of Congress, and the President issued a declaration on Monday declaring this American Heart Month. And it's really to increase awareness and to make people aware that heart disease is the #1 killer of not just men, but of women in the United States as well.
And this is occurring at a time when our country is seeing this obesity epidemic, especially among young kids. It's so troubling, and you see this ticking time bomb of young kids growing up into obesity with all the problems associated with it. And so are we moving in the right direction or the wrong direction?
Well, you hit the nail on the head, Doug. And we talked a little bit a second ago about how there was just a study that came out that said that if we could really get our arms around obesity and cigarette smoking in the United States, we could reduce mortality or death from heart disease by an additional 50%.
Wow.
Obesity is an epidemic. Our diets are an epidemic. The foods that are least expensive are the worst for you. And if people would just become a little bit more aware of what is considered heart healthy, know their risks, know their numbers, their blood pressure, their cholesterol numbers, we could make tremendous inroads into heart disease.
I've read that even children are starting to get clogged arteries, or at least the beginning evidence of that. Does that happen even in a child?
The process starts early. I mean, women are a little bit more protected than men in terms of age, but I've done coronary interventions on women as young as 34 years old. Really? So the disease starts in childhood, but the bad habits start in childhood. Right. The obesity starts in childhood. The sedentary lifestyle starts in childhood.
That's the thing. You know, we hear this so much, and everybody knows what's good for us. We know what's bad for us. Why can't we break it? Why?
Answer that question and you've hit the $50 billion question, because we'd reduced health care costs by that much.
Yeah.
We just need to be more aware. I think women have this false impression that they're immune from heart disease. More women die of heart disease in the United States than men every year.
Interesting.
850,000 Americans die from heart disease every year. And we can make substantial impacts. We've reduced mortality or death from heart disease by 25% in the last 15 years. That's a tremendous number, but we still have a long way to go.
It's a matter of going to the doctors and you say getting your blood pressure and things like that?
Well,
first?
I think people need to know their risk factors.
Okay.
There are certain risk factors you can't do anything about. Your genetics, your parents. They gave you what you got and you can't get rid of it. But everything else you can do something about. You shouldn't be smoking. You should not be obese. You should be controlling your blood pressure. If you have risk factors, if you have a family history, you should know your cholesterol. I've gone up to friends who have risk factors and have asked them, what's your cholesterol level? What's your LDL, bad cholesterol, and HDL? And they don't know.
Some people, I think, don't even know what an LDL is.
Well, LDL is your bad cholesterol, and you want that to be down around 100 for the general population, and HDL is your good. But we need to know our numbers.
What do we want that to be?
Above 40 or above.
Okay. Just so
now,
people
if you
know.
have disease, the goals are different. Then we're being very aggressive to reduce recurrent disease. But people need to know their numbers. They need to know what their blood pressure is. Treat your blood pressure. Smoking, there's no good rationale for smoking.
Talk about a ticking time bomb with smoking.
Oh,
yeah.
just in every possible respect.
Right. Let's talk about the specific symptoms of heart disease. What are some real warning signs to you that suggest you need to get to the doctor?
Sure. The textbook classic symptoms would be a heavy pressure sensation in the chest. People talk about an elephant sitting on their chest. Increased shortness of breath with exertion, or when you're walking, you go up that hill and suddenly you're very short of breath. But they can also be very atypical. This is one of the reasons that women come to diagnosis later. They tend to have more atypical symptoms. It can be some shoulder aching. It can be some arm aching. Any aching that gets up into the jaw when you're exerting yourself, that's clearly a heart symptom until proven otherwise.
So the huge arteries come out from the heart. Anywhere those arteries are, I mean, this is all in the vascular area, the head, right? The shoulders?
Not so much. Right? Can I take 30 seconds to give you a quick
do.
lesson?
Yeah,
okay.
inform us.
The heart's a muscle. it squeezes, pumps blood. That's its job. Like all muscles in the body, it needs a blood supply to live. Where it gets its blood is not from the inside where it's pumping. It's these 3 very small little arteries that run along the outside of the heart that are called coronary arteries. And you can develop blockages in those arteries. When you have a blockage that restricts blood flow and you increase the work of the heart, you get symptoms that we call angina. That's heart pains because part of the heart's not getting enough blood.
Okay.
If the artery closes completely and no blood goes downstream, that's a heart attack, and part of the heart muscle starts dying. And that's when the clock starts ticking. And if people have chest discomfort that doesn't go away, heaviness, pressure, squeezing up into the neck, arms, jaw, they need to get to the hospital right away because the sooner we treat them, the more heart muscle we can
Those
save.
are big time signs.
If you're experiencing those symptoms and you're, say, alone in the house, what should you do in addition to call 911, get an ambulance there right away? Should you lie down? Should you be still? Anything you can do to help your chances of survival?
Chew a few aspirin, lie down, and wait for the EMTs to show
So the
up.
aspirin is what you hear, and that is real.
Absolutely. Aspirin is another medication that, like alcohol, we can't advise everyone to take it because of potential side
Some has
effects.
some good stuff. We have a couple
Right.
seconds left, Doctor. I
Sure.
wanted to ask you, you talked about the cholesterol levels and knowing your numbers. You know, when you go into any drugstore, they have all these tests. You could do a million drug tests and know yourself. Do you recommend something like that if somebody, it's hard to get people to the doctor. Could they test it over the counter?
I don't know that it's available over the counter, but there are lots of community-wide screening programs. Anywhere you can get your cholesterol checked, go ahead and do it. Just find out your cholesterol, your LDL, your HDL. Even if you don't have risk factors, if you have an LDL over 160, you need to be treated.
Okay, 160. We'll keep that number in mind. Dr. Warren Levy, thank you for your time.
Thank
so
you.
important.
Good to meet you.
Good to
Nice
see you,
meeting
Doctor.
you.
Thank you.